in people is there's been a lot of mistrust. And I know talking to you and talking to Dr. Chandra, it's just you really see when I talk to you two how compassionate you guys are and how sincere you guys are, truly just about helping people. And I know that there is a lot of doctors out there, nurses who they truly do care and they don't just view people as a dollar sign, but as a real life person that matters, even though you don't know them, you've never seen them before until this moment, but they do matter. Um, so how do you think that you can kind of build that disconnect? I mean, have you felt that disconnect? Because from my side, I've have felt that little disconnect a little bit. And if so, how do you think that you can kind of close that gap a little bit?
Yeah, that's a good observation and a good question.
Hmm.
I think that there has been a definite disconnect. And I think, how COVID rolled out was also a little crazy. How we were made to do the things we did in hindsight, we probably wouldn't have done from very large studies that have come out. And, mask, no mask, double mask, all of that silly stuff. But I think that lost trust. I mean, I lost trust. I lost faith
Yeah.
um, in some of the things I was hearing, and so you always try to default to science, and you try to look at the data, and you say, well, what's the truth and what's the evidence? And you've also got to rationalize in your mind what's honest, how you can make a difference, but also how you can you've got somebody else's life in your hands, like your family, and you're responsible. Um, what would you do that would cause the least amount of harm? And I think sometimes you've got to just think, well, is this sensible to do? But sometimes when you don't know about, new technology like vaccines and um, trying to understand what that would do to your genome and manipulate it, is now coming out. And so, you know, all the studies do show that you do get, an extra pro-inflammatory response. So there are people who get pericarditis or have heart attacks more predominantly after getting certain types of vaccines. And that's obvious, that's out there, it's in the literature. So now you reset your point of normality at what you say to patients. And I think you've got to always come out with the truth, and whether it's good or bad. And you've got to deliver it in the right way to then, like, saying at the end, well, if this was my family member, what would I do? And as long as you can ground yourself in that level, then I think that's the honest way of doing it the best you can every day to go to sleep with a clean conscience and to know that you didn't hurt anyone, and um, that kind of responsibility that you have, you can also, there's also good people to share that with, that
Yeah.
burden. um, and sometimes I try not to bring that home to my family because they have enough to deal with, but it's important.
Well, that's what do you do to try and keep your